Good afternoon and welcome to our Social Determinants of Health Congressional Briefing, hosted by Aligning for Health and Trust for America's Health. My name is Tim Hughes, the External Relations and Outreach Manager at TIFA. We would like to thank our speakers and audience for being with us today. For today's webinar, audio will be accessed through your computer speakers or headphones. Real-time captioning is provided today by Lenore Schatz of ACS Captions. For captions, click the multimedia viewer icon under the circle with 3 dots at the bottom of your screen. Next, on the right side of your screen, locate the link in the captioning panel that says Show Hide Header. If the captioning window ever disappears, click the multimedia viewer icon to bring it back. We encourage you all to share your thoughts and questions about today's presentation by typing them into the Q&A box. We'll try to answer as many questions as we can as time permits. To open the Q&A box panel, click the circle with 3 dots at the bottom of your screen. From there, select all panelists in the drop-down menu so that your questions will get sent to the correct location and press Enter. It is my pleasure to now introduce Daphne Delgado. Daphne is TIFA's Senior Government Relations Manager, where she focuses on chronic disease prevention and control priorities, including obesity, physical activity, nutrition, healthcare, financing, and public health funding. Welcome, Daphne.
Thanks, Tim. Welcome, everyone, today. We're so glad for you to join us all. Like Tim said, I am Daphne Delgado. I am Senior Government Relations Manager at Trust for America's Health. Both myself and Melissa will be moderating today's session. Melissa, do you just want to quickly introduce yourself?
Sure. Hi, and welcome, everyone, to the webinar. My name is Melissa Quick, and I'm a co-chair for Aligning for Health.
Thanks. Tim, next slide, please. So just a quick run through of what we expect to go through today. We'll just do a few welcomes and introductions, a welcome of who Trust for America's Health is and who Aligning for Health is. We'll do a brief presentation of an overview of what social determinants of health are and why they're important. And then we'll open it up to our main panelists. And then after they do introductory remarks, then we will open it up for a robust question and answer discussion where we hope to go through as many audience questions as possible. Next slide, please. So just as a quick introduction for those of you who don't know who Trust for America's Health is, we are a nonprofit, nonpartisan organization based in Washington, D.C., and we're really focused on promoting optimal health for every person and community in the U.S. And we do that by making the prevention of illness and injury a national priority. TIFA, I think, is most widely known for the number of reports that we issue every year on a whole variety of public health topics. Each report contains a section of evidence-based recommendations that make prevention and health equity focused, that make recommendations for programs and policies. Some examples of topics of recent reports include our annual reports on obesity, emergency preparedness, public health funding. We've done a series of briefs on COVID-19 specific issues, and we also have done a recent briefing series on suicides and substance misuse. Next slide. And now Melissa will introduce Aligning for Health.
Thanks, Daphne. So Aligning for Health is an advocacy organization that is focused on addressing barriers and challenges that limit our ability to improve health outcomes and well-being for all. As a coalition, we are focused on developing and promoting actionable policies to address such challenges and to create opportunities for states and local governments, healthcare organizations, and non-healthcare organizations to work together to develop cross-sector coordinated solutions to address health and social needs. Next slide. But we are here today to talk about congressional opportunities to support effective and innovative approaches to addressing social determinants. But first, to provide a bit of background. Social determinants are the conditions or environments that we inhabit, including our communities, our homes, our access to healthy foods and education, employment, transportation, or racism and discrimination. These factors all have an impact on our health and overall well-being. For instance, people without access to grocery stores with healthy foods are at higher risk of developing obesity, diabetes, or heart disease. And as we've seen over the course of 2020, social factors such as type of employment, housing conditions, or even transportation options have exacerbated the impact that COVID-19 has had on certain communities. Next slide. So although we currently spend over $3.6 trillion on healthcare per year in the United States, the healthcare services that we receive are estimated to contribute only about 10% of our health outcomes, with social determinants and individual health behaviors driving the remainder. With the growth in value-based care and a focus on advancing health equity, social determinants are receiving increased attention from insurance companies, hospitals, healthcare systems, and governmental agencies interested in improving health outcomes and controlling costs. Unfortunately, however, the siloed way in which healthcare, public health, and social services are paid for and administered has limited cross-sector coordination both within government agencies, but also across private and nonprofit organizations in the health and social services sectors. Breaking down these silos and incentivizing collaboration between programs and systems will help to ensure that they are most effective in improving health and well-being. Next slide.
As Melissa said, social determinants of health are really those factors that significantly impact a person's health, like where they live and where they work. But much of our healthcare system is really based on looking at those immediate factors. So instead of waiting for individuals to get sick and treat them, public health needs to be prioritizing what we call primary prevention, which aims to prevent disease or injury before it occurs. And right now, if you see on that graph, we're usually focused the majority of our efforts in that midstream section. We're looking to address the individual social needs of patients, looking to change certain programs. But in order to make a long-term difference, we cannot solely look at individual needs. We need to do what we call going upstream, and we really need to look at those community needs. So, for example, we are seeing incredible innovations in healthcare and in health insurance right now. For example, Medicare Advantage pays for certain patients or beneficiaries to have Uber rides to doctor's appointments, or provide temporary housing, or providing 2 weeks worth of meals after a hospital discharge, things like that. And these are incredibly important midstream efforts. Without attending to the social needs of individual patients, they may never really get the health outcomes that they need. But while those efforts are important and necessary, we really need to complement those midstream efforts to look for community-wide changes. So, for example, if we're offering Uber rides to the doctor's appointments because patients can't make it on their own, we also need to be looking at the whole community and making sure that the transportation system is set up in a way that is effectively meeting the health needs of its communities. That's what we mean by going upstream. And we can do that for all of the social determinants of health issues, whether it's transportation, food security, employment, things like that. Next slide. And I should also, we should have said this at the beginning, but after the presentation, a few days afterwards, we'll have the recording available. So we will send you the recording and a copy of the PowerPoint slides. I know that that's always a popular question. Getting back to the presentation, healthcare and public health need to be empowered to work together to address social determinants of health. Right now, in how healthcare and public health are usually implemented or funded, there can be a big silo. But if we can break down those silos, either on the federal level or on the local levels, we can ensure that patients and communities are getting the services that they need. This is a quick example that you can look at in more in depth later once we send the materials of how public health and healthcare can work together to address certain social determinants of health. So for example, in that first left-hand most column on the top, healthcare systems can work to implement screenings for necessary social, economic, and safety issues in their clinical and outpatient settings. In turn, community-based organizations and public health departments can offer those healthcare settings the best practice screening materials. They can aggregate and analyze that data across facilities, and they can coordinate what are the community-wide needs and resources available to the community. Next slide.
There are examples across the country where organizations as varied as state Medicaid agencies, public health departments, aging services agencies, public housing authorities, and others have started to work together to complete the spectrum of activities that Daphne just referenced in the previous slide. However, often these examples are few and far in between. The siloed nature of program funding, administration, data collection, and reporting all make it really difficult for entities to stitch together comprehensive and cohesive programs and services. So to help address some of these issues and to ensure improved outcomes, members of Congress have introduced several pieces of legislation that would improve collection of data related to social determinants, would provide guidance to state Medicaid and CHIP programs to help them address social needs, would require the federal government to develop cross-agency advisory councils related to social determinants, and would provide funding to states or other eligible organizations to plan for and build cross-sector capacity to address social determinants. Today, you'll hear from our panelists about the first two on this list here, in particular, the Improving Social Determinants of Health Act and the Social Determinants Accelerator Act. But we wanted to note that beyond the list that's on the slide here, there are a number of bills that have been introduced over the past 2 years or so that seek to address social determinants and improve health disparities. And we expect that the 117th Congress will be even more active in this space. So with that, next slide, I will introduce the panelists. So first, we'll have Liam Stedman, who's a Senior Policy Advisor for Representative Cheri Bustos. Then we'll hear from Josh Isaac, who is the Legislative Director for Representative Nanette Berrigan. Then from Kristen Fluke, who is the Legislative Assistant for Representative Kathy Mcmorris Rogers. Then from Shane Hand, who is the Legislative Assistant for Representative Tom Cole. And then finally from Kripa Srikada, who is a Health Policy Advisor for Senator Tina Smith. And as a disclaimer, the panelists will be speaking on behalf of their bosses. Their comments do not reflect their own views. So we'll start with Liam.
All right. Thanks very much, Melissa, and thanks very much for having me on this call. As mentioned, I'm Congresswoman Cheri Bustos' health staffer, and just for a little bit of background, my boss represents Illinois' 17th Congressional District, which includes much of northwestern and central Illinois, with the Mississippi River as the district's western boundary. So there are 14 counties in the district, 11 are rural, and then three are our biggest population centers, which include Rockford, Peoria, and then the Quad Cities. So our priorities for the 117th Congress are really focused on social determinants that are impacting our communities and others around the country. So for instance, like many other districts, Illinois 17 faces things like health provider shortages and food deserts, which undoubtedly this is negatively impacting health outcomes. So to combat these issues, this Congress, my office, along with Reps. Cole, Mcmorris, Rogers, and McGovern, we introduced the Social Determinants Accelerator Act. So this legislation, just to give a brief overview of it, would create an interagency advisory council on social determinants of health. The council is made up of experts from many different agencies, including HHS, HUD, Labor, Agriculture, many others. And so this council, along with CMS, would make up to $25 million in grants available to state, local, tribal governments to develop plans to fix local social determinants of health that are negatively impacting Medicaid populations. So the council would provide things like technical assistance to grantees to help them implement their plans and find existing federal resources to help meet their goals. So a grant like this could be used by a city like Peoria, Illinois, to develop a plan to fight things like food deserts. So we're happy that this bill has gotten a lot of bipartisan support so far in Congress. So we have 44 bipartisan co-sponsors. The legislation's been endorsed by over 80 national organizations, and has also been introduced on the Senate side by Senator Todd Young out of Indiana. So I would say for the 117th Congress, our goal is really reintroducing this legislation, and hopefully by the end of the Congress, making sure that this legislation becomes law. But I also wanted to mention that there's still work going on for the 116th Congress here in the last few days. So one thing that I'm watching closely is the this end of year package. So for the House fiscal year 2021 Labor, Health, and Human Services funding bill, we included many provisions from the Social Determinants Accelerator Act in the funding legislation. This includes creating that Social Determinants Council and awarding $10 million worth of grants in a pilot program to local communities. So I'm watching this closely, hoping that this gets included in the end of year package here within the next day or two. But with that, that's really our priorities for this Congress, and I will go ahead and turn it over to Josh.
Hey, thanks, Liam. So I'm Josh Isaac. I am the Legislative Director for Congresswoman Annette Berrigan, focused mainly on her healthcare portfolio for her work on energy and commerce in the Health Subcommittee. So the issues around minority health disparities, and social determinants are incredibly important to the Congresswoman. So she represents a district in South Central Los Angeles. So it's incredibly working class. It's about 90% Latino African American. We deal with a lot of issues around access to transportation, a lot of issues around food insecurity. There's a lot of environmental justice issues. So there's a few freeways that surround the district, also the Port of Los Angeles. So this leads to a lot of chronic conditions. There are high rates of asthma in the district. The Congresswoman likes to talk about seeing kids having inhalers around their necks. We also have high rates of diabetes, one of the highest rates in California and around the country. So she's seen firsthand sort of how social determinants affects their constituents, and also how the current pandemic has sort of exacerbated these issues. So in response to that, we introduced the Improving Social Determinants of Health Act. So this would be a bill that would provide funds to the CDC to establish a program focused specifically on social determinants, to work sort of within other agencies and coordinate. It would establish a grant program for state, local, territorial, tribal health agencies to tackle this issue. And it would also award grants to nonprofit organizations and institutions of higher education to conduct research on social determinants of health best practices. So some of the other things that we're focused on sort of tangentially in the space, I mentioned environmental justice legislation. So we introduced a legislation relating to greening our ports, called the Climate Smart Ports Act. That would invest in clean energy in our nation's ports, sort of for equipment, transportation issues, to sort of reduce that pollution that communities, and especially communities of color, have to deal with living so close to our nation's ports. Also dealing with, we did a bill, the Clean Energy Microgrids bill, which will provide renewable energy microgrids to communities and low-income communities to sort of tackle issues around natural disasters. So if there's a forest fire, earthquake, hurricanes, that places like hospitals and low-income communities can keep the power running. So that's sort of where we are in this Congress. And like Liam said, looking forward to seeing what's in the end of the year package, and hoping that there's some investments here, especially for low-income communities like the Congresswoman's district. So with that, I'll pass it along to Kristen.
Thank you all for having me. I appreciate your time. So my name is Kristen Fluke, and I am the Health Legislative Assistant for Congresswoman Kathy Mcmorris Rogers. She represents the 5th District of Washington State, which is Eastern Washington. It directly borders Idaho, and we represent Spokane, which is the 2nd biggest city in Washington state. Other than Spokane, the district is fairly rural. So we've had the unique opportunity to kind of see the social determinants of health aspect from all over the map, whether it's urban, suburban, or rural. Some issues that have been brought to my boss's attention, which led her to help introduce the Social Determinants of Health Accelerator Act, are specifically one issue that kind of resonated with her is the issue of hospitals discharging patients who, their acute health issue is over, so they're being discharged. They have nowhere to go due to homelessness, or they have no support at home for a variety of factors. And then they end up getting readmitted, and the health issues never actually subside, and that increases health costs and reduces health outcomes. So that's something that she kind of was putting her head together with district stakeholders to, kind of alleviate the issue. And another one in terms of from a rural aspect is the transportation issue. A lot of elderly folks in our district have had trouble getting to doctor's appointments. Therefore, they're kind of forgoing cancer screenings and other preventative care. So with that, like I said before, and it's been mentioned earlier, she helped introduce the Social Determinants of Health Accelerator Act alongside Representatives Bustos, Cole, and McGovern. So we appreciate the partnership there and with Aligning for Health and others. And one other thing that she has kind of trying to put a finer tip on is that oftentimes when we discuss healthcare and health affordability and accessibility, sometimes we're really only referring to insurance and coverage and kind of, wonkier things. And something that's been resonating with her recently is that we need to continue the conversation as it relates to underlying health issues of why Americans are unhealthy, and fix the root problems, promote healthy behaviors, and that will ultimately promote better health outcomes and lower costs. So with that, I am happy to turn it over to Shane and happy to take questions at the end. Thank you all.
Thanks for having me today. I work for Congressman Tom Cole, who represents the 4th District of Oklahoma. So for reference, that is the southern suburbs of Oklahoma City down to the south central portion of the state. So we do have some suburban areas, but also have a lot of rural areas, which is kind of what brought us into the social determinant conversation. For reference, in Oklahoma, 34% of Oklahomans are living in rural areas, so access to transportation and timely access to care is a very important issue. 16% of Oklahomans do live in poverty and experience the challenges that are associated with that, whether that is housing stability, the ability to have access to utilities. Another 14% lack insurance, and then 1 in 6 individuals is food insecure. Oklahoma has recognized this. The State Department of Health did do a study this year where they went out into the community and surveyed individuals throughout the state, and they came back with findings that access to healthy food, access to safe spaces for physical activity, and education and transportation were the state's main barriers to having a healthy population. So that's what attracted us to the Social Determinants Accelerator Act. When Congresswoman Bustos' office came to us, we saw that as a really good opportunity for states like ours to use Medicaid dollars more flexibly and address some of the needs of their population. We've been pretty encouraged to see that our state is looking at this issue specifically within Medicaid. We had a referendum earlier this year where our state finally decided to expand Medicaid, and because of some of the cost concerns that the state has had, it is looking at a managed care model. It has really made social determinants a crucial part of any plan that a managed care organization has to come in. So in its request for proposals, it's been pretty upfront with any interested organization that they have to have in their proposal examples of how their operational structure and practices will support the integration of social determinants of health within their plan of care for the state's Medicaid population, how they're going to identify which segments of the population have which social determinant issues, and then how they are going to integrate all of that within the delivery of care. So We think that Medicaid is a great place to start addressing some of these issues for a very vulnerable population, and we're hoping that Congress in the 117th, especially after seeing everything with coronavirus and how that's had disproportionate impacts on certain communities, will really start to look at these issues. And I'll turn it over to our next panelist.
Well, thank you all for having me. It's an honor to participate in a bipartisan discussion on such an important topic. I'm the health policy advisor for Senator Tina Smith. She represents the entire state of Minnesota. And she starts from the value that all people should have access to quality health care that they can afford. And so I think when we dive deep into why some people have access to better insurance than others, you know that there are upstream factors that impact whether someone has access to affordable health insurance in the first place. And when you look back even further and peel that onion back further, you compare health outcomes between groups, it's obvious there are social influences of health that are a bigger factor than medical influences. And I think Kristen actually just made this point. We know that clinical treatment accounts for 10 to 20% of an individual's overall health, while 80 to 90% of health outcomes are driven by social determinants of health. And the social determinants drive the disparities that are exacerbated in communities of color. And communities of color are more likely to face challenges accessing quality health care, healthy food, suffer greater exposure to air pollution, and are hardest hit by growing levels of poverty and unemployment. And this is why we see COVID-19 in particular having a great impact on communities of color during the pandemic. So from a federal perspective, we should discuss and address these issues more upstream, which I think has been discussed by everyone so far. This is why Senator Smith was interested in introducing the Senate companion to the Improving Social Determinants of Health Act. Senator Smith is also a member of the Senate Health Committee and the Senate Committee on Indian Affairs, so she's particularly interested in lifting up the voice of American Indians and Alaska Natives. That's why the Senate companion to the bill actually includes a non-competitive set-aside for tribes and tribal organizations, which are historically at a disadvantage from accessing federal grant programs. And regarding the bipartisan nature of this issue, even though our bill is not bipartisan in the Senate, I think there is an opportunity to push on this issue in a bipartisan manner at this next Congress, especially working with our friends in the House. If we make the economic argument for why improving social determinants of health not only improves health outcomes, but reduces federal spending on healthcare, I think we can see that there's an obvious common ground on this issue. And I also believe this will be an important priority for the Biden-Harris administration. Senator Harris is actually a supporter of our bill in the Senate and has led legislation to establish a task force on COVID-19 racial and ethnic disparities at the federal level. So I think there's a lot of good opportunity here, and I'm just excited to be part of this discussion and happy to answer any questions.
And thank you to all of our panelists for those opening remarks. I think it sets the stage for a really robust and important discussion. Just as a reminder to the audience, if you do want to ask a question, please do it under the Q&A feature of the WebEx platform. At the bottom of your screen, you can see the three dots. Click on the Q&A box and then the select all panelists. We will try to get to as many questions as possible in the time that we have left. To kick us off, though, I do want to ask all the panelists just a quick forecasting question. So as the 117th Congress starts next month, what do you think are the biggest opportunities for social determinants of health policy? You know, included in that question, are there any issues that you think are going to become more active or become more important in 2021? And do you think that there are any specific issues where there might be special alignment between Congress and the incoming administration? I'm opening it up to whoever wants to start.
I can try to jump in there. So I think I kind of spoke a little bit about this in my opening comments. I think there's going to be great opportunity to be creative on this issue. I think given the Biden-Harris administration's priority on health equity, I think there are a lot of ways in which we can work with them to see, specifically when it comes to addressing the social determinants of health. How do we kind of push on the White House to make a greater commitment to make sure that the different agencies are communicating and collaborating on these issues, since it really can't be, all under the jurisdiction of HHS. So that's one thing I think is going to be important. But also thinking through creative ways on how do we work with CBO or OMB to provide estimates of what the impact of health inequity is on budgetary projections or financial projections. I think that's going to be helpful in making these arguments and making more sustainable changes too.
I'll jump in. So I think we're going to have a few opportunities, maybe in larger packages, sort of like another COVID relief package early in the year, potentially maybe infrastructure. There's a lot of opportunities, like I was mentioning, investing in ports or investing in other areas where we could try to get some funding that will help address social determinants. I think appropriations bills are obviously a good avenue for that. Where I see sort of an alignment with the Biden administration, I see a lot of bipartisanship around the issue of maternal mortality. We had some hearings in the House side on that issue earlier this year. So I think, addressing that where there is huge disparities in maternal mortality, I think, we might be able to do something around food insecurity or housing access and affordability. I also think that there is a potential relating to access to higher education. I know the Biden administration is pushing an education plan, especially investments in things like community college. So I think all these types of investments can be very helpful to try to, address social determinants.
I know for our end, one of the ways that we think that social determinants can be addressed in the next Congress is just making sure that when funding is given out under different programs, whether that's appropriations, a COVID relief package, or any other kind of legislation, that it's done in an equitable manner. Kripa mentioned that her boss has a big focus on American Indians and Alaska Natives. My boss does as well. He is a member of the Chickasaw Nation, so for us, making sure that any kind of funding for healthcare and social services does include eligibility for tribal governments and tribal health departments to be able to access that funding. We found quite a few times where in the first draft of bills, they're left out. And then we have to go as our office and say, like, hey, this is important to us. Here's our perspective and how this affects Oklahoma and a number of our tribes and how they're being shut out of funding. And that happened quite a few times at the beginning of any COVID relief package. And we've gotten better, and it's usually gotten in the first draft now. But just making sure that in the future that remains something that is at the forefront of everybody's mind is do all communities have access to this funding.
Great. Well, we can move on to the next question. So Shane and a couple of the other panelists have mentioned the growing kind of influence or recognition of health inequities across the country. And in large part, I think a lot of the recognition is due to COVID-19 pandemic and how it has really been shown to impact certain communities more than others. So I'm curious your thoughts on how you, from your individual perspectives and from your perch on the Hill, have seen the discussion on health disparities and social determinants change over the course of the last 9 to 12 months, however long ago March was. And, as individuals have faced certain health and social needs during kind of social isolation, or how COVID-19 has impacted their communities.
Happy to jump on this one, Melissa. I think the conversation has changed or refocused in a lot of different ways throughout COVID. I mean, I think everyone has seen the statistics coming out about how different communities of color are disproportionately impacted by COVID-19. I mean, that has been a major focus and something we would like to address here in the coming future. I think, COVID has really shined a light on, healthcare provider shortages. One thing that we've seen, at least across my district, including in rural areas, is, if you don't have enough providers already, when they unfortunately get sick, that makes the problem, even worse. So that has really propelled how provider shortages is a major issue in our country. So I would say that those are two that have really jumped to the forefront there. Another one that I've heard a lot of is lack of access to, mental health. When the pandemic hit, lack of mental health providers, and then a switch over to telehealth, the inability to provide some of those services like group therapy via telehealth, which is very difficult. My way of saying there have been a lot of changes in how we're discussing social determinants of health with the pandemic, for sure.
Yeah, I might also just piggybacking off of what Liam mentioned. As I mentioned before, my boss's district is also very rural, and kind of, I guess a symptom of the virus itself is the fact that a lot of hospitals had to, eliminate their scheduled procedures and things like that. So a lot of our critical access hospitals have had to, close down a lot of, other than their emergency departments, a lot of their scheduled procedures, which cut off their revenue. And although we provided $175 billion, I think it was, to the provider relief fund, they're still struggling. So I would just second what Liam said in terms of provider shortages. And, we need to think of creative ways as how to help our critical access hospitals and other rural providers.
I think we're going to take some of the panelist questions now. So my first question to you all is, especially COVID-19, again, social determinants of health really runs the gamut of all these different factors that affect one's health. So, but given the cost of poor health to our nation, how can we get policymakers like your boss or even other elected officials, whether they're on the state level or federal level, to consider the health impacts of all decisions in different sectors, like infrastructure, like Josh was talking about, or transportation, like Kristen and Shane have mentioned, food, environment. So in other words, how can we push for a national health in all policies commitment? And is there an appetite for that?
Yeah, I'm happy to jump in here. I think there certainly is, an appetite, I think, from, all of our bosses for sure, to have a more, I think, robust conversation and bold policy proposals on this front. I think, as I mentioned a little bit earlier, I think it's going to be really important to spell out, the economic savings and federal savings that can come if you address some of these factors upstream, as opposed to, always focusing on, the medical care side as opposed to the social management side. And so I really do think it comes down to, how are we assessing and scoring our different bills and policies and regulations that we put out, and, how can we work with, the Congressional Budget Office and the Office of Management and Budget to make sure, we're able to have a more robust assessment of these savings, because I think that has been an issue that has held up, I think, more meaningful progress on this front. So it seems like that's an obvious place to start pushing in.
Piggybacking off of what Kripa was talking about, I remember my time in the Senate offices. We tried to work on legislation that would have, I think, dynamic scoring. So I think the CBO just scores the first 10 years of a policy, but a lot of work in the preventive health space, you see those savings long term, so that, you need to allow CBO to look forward a lot more into the future so that they're able to drive down scores on bills so that people can actually see the savings that these bills provide.
Yeah, and building off of what Josh said, there is a bill in the House that I am aware of that does some of that, where rather than scoring health bill on just a 10-year basis, you have that initial 10 years, and CBO does an additional 30 years. You can really start to see some of those savings. So it's like, well, it might look like a cost at the beginning. You can see like, oh, like the 10 years, first 10 years we're spending money, but look at all this money that we save later on. So I think it's passing legislation like that where you can really start to look at a longer term window where we're not thinking in just these like false 10-year increments, but actually looking at generationally what's happening here.
So it seems that we're getting a lot of questions about kind of return on investment or the outcomes, and how do you kind of ensure success of any legislative approach that seeks to address social determinants. And, one challenge that we have encountered a lot in thinking about this issue is the wrong pockets, situation where, you might address social needs in one area and savings occur to another area. And so it kind of makes it challenging when thinking about return on investment for one particular sector to make sure that it functions appropriately. So, one of the panelists, participants asked a question kind of thinking about how to think about this in more of a cross-sector manner. And I'm curious to what extent you guys have thought about ways to ensure that, to the extent that there is return on investment or you're thinking about the long-term, budget implications of some of these preventive measures, how can you think about that across different sectors beyond just the healthcare sector or so on? Don't all jump at once.
I can start. I think at a very basic level, it might seem utilitarian, but we traditionally measure return on investment in terms of how much money do you save or recoup. And while that might not seem like the kindest measure, we do have finite resources within the federal government, and finding ways to more flexibly spend money and spend it in a wiser way allows us to make those funds go further. So I know, for using Oklahoma again as an example, a couple of years ago, the state had a very small pilot program where they picked a couple of different populations that had a specific health need, and then started looking at some social interventions that they could make to help those populations. And they found that for every dollar they spent on social intervention, they saved $3 in medical spending. So not only did you improve the health of an individual, you also saved 3 times as much as you spent for a net $2 saved for every dollar. So I think talking not only about return on investment as look at how you're improving the life of a person, but also look at the money that we're saving and where can we spend that elsewhere to continue making further investments in individuals.
Yeah, to jump in here and to piggyback off of Shane a little bit here, when I think of return on investment, when we're talking about some of these bills and investing in social determinants of health, I think my preferred return on investment would be improving health outcomes. That would be number one, to say the least. At the end of the day, if we are saving the federal government money by improving those health outcomes, that is great too. So I think it's, both of those pieces, but for me, number one is definitely the health outcomes.
Related to this discussion, we've gotten several questions on this return on investment, but we've also gotten this question of how do you appeal to some of these members of Congress who may not want to be spending money on investments in social determinants of health, particularly housing and food insecurity. Do you guys have any advice to the audience on how advocates can best appeal social determinants of health to their elected officials?
I can start. So, I don't want to speak for other offices, but what is effective, I think, for my boss and when people come in to advocate for certain issues is always related to the district, always related to how these policies are going to impact people, and do it to as granular a way as possible to be like, look, this, like, middle school would qualify for this grant, or this, a community center can get this type of resource. And the more you do that, and you sort of, it sort of has a snowballing effect where you can take that, as a staff, you can take that to the boss and be like, look, this bill would, greatly benefit your constituents. And that sort of, I feel like is a good way to at least get in the door to try to get some of these policies moving.
Yeah, I completely agree with that. From my boss's perspective, she is, a pretty fiscally conservative woman. So in terms of the granular aspect that Josh mentioned, I think that would be very helpful, because if you look through a legislator's eyes, they have to justify government spending to their constituents. So if they give an example that a constituent can understand in terms of like a local school or, a local homeless shelter or something like that receiving funds which are helping the community, it's much more easy from our perspective to justify, using taxpayer dollars a certain way that if you look at it on a national level, they might not totally understand the impact it's having. But when you kind of break it down locally, that's much more helpful. And, I'm not going to speak for all Republicans, but my boss in particular appreciates the idea of the government giving grants to local governments and states so that they can implement their own practices and policies rather than heavy-handed mandates from the federal government. But that's just my boss. So.
Yeah, I agree completely. And I think, from my boss's perspective, she really appreciates when constituents come in and share their voice and share their stories specifically, and, letting data guide your talking points on why these issues matter. But if you really, use your stories to illustrate what this actually means and why it would result in better health outcomes, I think painting that picture to say if we invested more in social determinants of health, then we wouldn't have seen such a disparate outcome when it comes to, COVID-19 or maternal mortality or, heart disease. I think that's really important for my boss, and I think they really do pay attention to those constituent perspectives for sure.
So another question that we got kind of teased off of this and to some of the remarks that you all made as part of your opening remarks. But it asks if you guys could speak to what you're hearing in your districts, and are social determinant issues generally the same, or how do they differ between rural, suburban, or urban areas?
I can try and answer that question. Since I think, the entire state of Minnesota, we have rural areas and urban areas. So certainly, I think the challenges are different across the state. To provide a specific example, when we were introducing legislation called the Rural Moms Act, it's specifically focused on addressing maternal mortality in rural areas. And when we were digging into the data, I think what was really shocking to us is to see, when you see a lot of these rural hospital closures, the data suggests that it's actually tends to be in counties where there's a greater proportion of African-American residents that the rural hospital closure is more likely to take place. And so I think, people have an assumption, that sometimes in rural areas, you're not going to see the same type of racial disparities as you are in urban areas, but I think we were pretty shocked to see that. But then again, when you talk about other issues like, broadband access, that's something that, we need to talk about investing more in rural areas to make sure that they have access to, Wi-Fi, high-speed internet. But I think we've also seen that this is an issue with our urban Indian populations in the Twin Cities, when they don't have access to high-speed internet in their own homes, like they rely more on, going to the library for that internet access. So it's kind of like cross-cutting issues in different ways. But I think really relying on the data and evidence is helpful in understanding, there's going to be a certain approach in one area versus another. I don't know if that really answers the question, but just trying to provide some illustration.
I think a special challenge that groups on the ground and nationally struggle with is that addressing upstream factors that drive these needs related to social determinants of health. No one system can do this alone. That's all what we've been talking about, right? So how can legislators help encourage, incentivize, support these cross-agency collaborations, perhaps break down silos of this wrong pocket problem that Melissa mentioned early on? What is the role of, I guess, Congress or your bosses to really kind of break down those silos to help these sectors work together to solve or to address these social determinants of health?
I can jump on that one. I think that we can play an important role in addressing these issues, these different silos. So, for instance, the Social Determinants Accelerator Act that my boss introduced with, Rep. Cole and Rep. Mcmorris Rogers is designed specifically to tackle this issue through this Social Determinants of Health Interagency Council. I mean, if we have people from HHS, education, labor, agriculture, all discussing these issues, working on these problems, helping local communities work through their local social determinants of health, I think that's a really good way to tackle the issues. So I think that my boss's bill is a good example of taking on that issue, and I think there are probably other strategies to make this work as well. So I think we do have a role to play here.
Yeah, I'll join in and do a plug for my boss's bill as well. I think, we investing in local public health departments, giving them money on the ground where they know where to spend it to try to address these issues, I think is very important. And I think our bill also encourages collaboration amongst agencies and the executive branch to sort of tackle this issue.
All right. What kind of role do you think that CBOs or providers, or how can they best partner with you all to kind of raise potential opportunities or solutions or, challenges that they are facing beyond just, giving specific examples, of how things could work in your district, but, what kind of partnership can they provide to you as you're thinking about these issues moving forward?
I'll jump out here on this one. If you guys, are seeing a specific problem on the ground or have, a policy idea, or even your trade organizations think you have a policy idea that you think can be helpful in fixing these issues, I want to hear them all day long. If you guys reach out to many different congressional offices and say that you have that policy idea, we might not agree with the policy idea, but we'll at least have the conversation and, if it reaches our priorities, find a way to move that forward. So, if you have an idea that fits my member or other members, I say reach out. I'm always super happy when someone comes to me with an idea that really works well. It's always a great thing to do.
So recognizing that we have 5 minutes left, I do want to give the panelists just an opportunity for any closing remarks if they have any. So I guess I will just ask this question that you guys can tie into your closing remarks. But how can advocates, Liam just mentioned this, but like, how can advocates best work with you and work with Congress to ensure that information is flowing and that we are working on the issues that need to be worked on?
I can jump in. I think, I totally agree with everything Liam laid out. I know that my office has an open door policy for anyone. I guess not right now because we're also teleworking, but, feel free to reach out and to, forward along your policy recommendations and, request time to meet. I think we're always willing to sit and chat with, constituents from Minnesota to talk through their ideas and suggestions. And I also think, we've found really successful collaborations with some of the stakeholders who are able to provide technical assistance on the legislation as we draft it and let us know, based off of your specific experience, how would a certain grant program work, or what are the additional flexibilities that you need in the legislation that, may have impeded some of the work that you've tried to do in the past. I think we certainly take that into account and appreciate that feedback. And I think, I would just close on that to say, I think, we're all here to serve our bosses and serve their constituents. And I think along with that goes an open door policy, and really welcome hearing from all of you about this issue and any other issues that you want to bring to us.
Yeah, I agree with everything that Kripa and Liam just laid out. Same goes for me, open door policy when we're not in the middle of the pandemic. But happy to, have an email dialogue, hop on the phone whenever. I think it's also helpful for stakeholders and other folks who might have an idea to, do your research and understand the members' district priorities, legislative agenda, what the district looks like. It just kind of makes it easier for us to, review legislation, review proposals, and come back with quick comments. And, the more data, the better. But yeah, I would also close on that. And thank you all so much for having me. And if there's anything I can do to be helpful, feel free to reach out.
Shane or Josh, do you guys have any closing remarks?
So yeah, thanks again for putting this together and having us all here. Just sort of parroting what everyone said. Please reach out. I think my boss is very supportive of anything that's going to move the ball forward, I think, in improving health equity and outcomes. And so, relating to the Improving Social Determinants of Health Act, that came out of a meeting that I had unrelated. And then, the ball started rolling when we had a conversation. Here we are. So I think, whenever you want to reach out, do it. I have lots of space in my inbox, and we can have a conversation.
Yeah, I would just echo everybody else's point that they made, which is just please reach out to your members and their staff and let them know what you're doing in the community, what problems you see are, and then more importantly, what you think the solution should be. Because a lot of times we think that we know the scope of the problem and how best to address it, and then we take a meeting and realize, there's actually a better way to do this. A lot of times we don't even know what the problems are until somebody who is on the front lines comes in and explains it to us. For instance, I worked on a bill for my boss that just passed the House a couple of days ago, and it was an issue that I didn't know even existed until somebody came into the office and explained how it was personally affecting them. And then through meeting with them again and other people around the country that had experienced that problem, it really gave us an understanding of it, and then kind of seeing what their solutions would be versus what we thought would be the best solution. So you all have more information on this than we could, and understanding than we could hope to. And we really do rely on your expertise. So please, again, always reach out to us and let us know what it is you see and what you think we should do.
Thank you all to the panelists. Tim, you can go to the next slide. I want to deeply thank the panelists and the audience for your time on this important issue. We hope that you have found this briefing valuable. Please feel free to reach out to either me or Melissa. Again, these slides will be provided to you in a few days, and you can always contact us then. For the audience that's still on the line, we just really want to make sure that while these 5 congressional staffers represent members of Congress and senators who are really leading this issue, all elected officials have to be involved in this. We suggest that, or we highly encourage you to reach out to your own members of Congress, tell them what an important issue this is, encourage them to co-sponsor the bills that we talked about today, and let them know that this is an issue that groups on the ground in their communities are paying attention to, and that they want something done. Again, thank you so much for your time on behalf of Trust for America's Health and Aligning for Health. We all hope that you have a great rest of your day and rest of your week. Bye, everyone.